Hello everybody, this is Dr. Kevin Connors, and we're going to go over some information on stages of an autoimmune disease. So if we're talking about autoimmune phase of Lyme, then understand that the definition of that is that you have antibodies to self-tissue. You have autoimmune Hashimoto's, the definition of that is that you have antibodies to self-tissue, in that case, the thyroid gland. With Lyme disease, it could be of any organ, any tissue in your body. With MS, it's antibodies to the myelin sheath cells, oligodendrocytes in your brain. That's destroying the myelin sheath. With rheumatoid factor, it's antibodies to collagen, or with lupus, it's antibodies to DNA. So we're going to get into that and talk about the stages then of an autoimmune disease. So we talked about in multiple places, if you have self-antibodies through a lab test, that is by definition an autoimmune disease, and they're named after what tissue is being destroyed, what tissue you have antibodies against. But there's another factor that's involved, and that is a stage of an autoimmune disease. And I'm going to give credit where credit's due. Dr. Datis Karatsian is my mentor, who I've learned so much from. If you are a practitioner viewing this video, highly recommend as a practitioner that you go and take Dr. Datis Karatsian's courses. He's got multiple courses. He's got one on autoimmune disease, but that's where a lot of this information is taken from. So giving credit to Dr. Datis Karatsian and everything that I've learned from him. I'm trying to make this simple for patients, so please forgive me as we go through this if it seems a little too complicated. So the different stages of an autoimmune disease are labeled stage 1, 2, and 3. Stage 1 being silent autoimmunity. That means the person may test in a blood test of having elevated antibodies to self-tissue of some kind, yet they don't really have any symptoms of the antibodies to that self-tissue. We'll get into a full description of this, so hold on with me. Stage 2 is what's called autoimmune reactivity, meaning that you also have elevated antibodies to a self-tissue, but your symptoms and clinical noticeable loss of tissue just isn't there. So you may have symptoms like, okay, talk about rheumatoid arthritis. My joints hurt, but I may not have any visible x-ray signs, or I may not have any visible swelling. So there's not as the clinical assertion isn't there. It's based upon symptoms and the blood test. And then stage 3, and there's a lot of fluidity between these, as you're going to see. Stage 3 autoimmune is full autoimmune disease where you have elevated antibodies, you have symptoms, and you have a very measurable tissue destruction of some kind. And the different autoimmune diseases named after different tissues, there's some clinical maybe argument, you could say, on whether a person's in stage 2 or stage 3, because based upon different research, you have to have X amount of percentage of tissue destruction in order to be in stage 3. From a clinical standpoint, really doesn't make any difference. You should be treating stage 2 and stage 3 very similarly. You certainly should be treating stage 1 as if you could potentially have full-blown stage 3, because a person could move from stage 1 to stage 3 literally overnight. And a person could stay in stage 1 for decades. A person could stay in stage 2 for decades. They have some symptoms. The symptoms have not gotten worse. They still have these achy joints at different times, changes maybe with the weather and such, but they've never gone into full tissue damage where they have deformities in their fingers and noticeable swelling, and so they've stayed in a stage 2. But if you don't start looking at the fact that you have symptoms of autoimmune disease, you could easily flip to stage 3, and that at that time it makes it much more difficult to care for. And once you already have measurable tissue destruction, some of those things are not reversible. Most of those things are not reversible once you have measurable tissue destruction. When you have gross abnormalities in your joint capsule formation and the arthritis that's going on with rheumatoid arthritis and deformity of the joints, those are not reversible things. So it's not a matter of, detoxing heavy metals and you're going to be all better and your symptoms are going to go away. You've moved to that stage 3. So many times it takes years or decades from going to stage 1 to stage 3. Sometimes it could just take days from move to stage 1 to stage 3, depending on the disease itself and multiple other factors. There's different types of autoimmune disease. We covered this in other videos. They're named after the tissue that's being affected. It's named after the protein in the tissue that the person has created antibodies against. So there's multiple different proteins in different tissues that you can create antibodies against, and that's really the name of the autoimmune disease that you're going to have. When we look at autoimmune disease, there's so many multiple immune factors of autoimmunity. This comes from Dr. Karatsian's course. These are factors that you're having to deal with when you're trying to look at this from a clinical perspective. This person may have depressed white blood cell production, leading to immune dysregulation. So autoimmunity always has to do with something going on that's causing some sort of immune dysregulation, causing an immune suppression in this case. They could have an active infection. You see this with Lyme disease. You can see this with mold, but you can see this with other vector-borne illnesses, other viruses, even Coxsackie virus, which is common to everybody. And then they end up with a pathogen upregulation of the immune system, and that can cause a cascade of effects that can cause an increased cytokine production and an increase, and you can develop antibodies wherever that infection is, just based upon the increased hyperimmune response at that area. So that you develop antibodies wherever that hyperimmune response is to tissues so they're surrounding that area. It can cause barrier permeability, not just intestinal with leaky gut issues, but certainly blood-brain barrier, which is even more serious, damage to the astrocytes, leading to all sorts of problems in antibody production of antibodies development to neural tissue, which is a very scary thing, but it's all too common. Overactive phagocyte cell activity, meaning overactivity of your immune cells, your monocytes, neutrophils, eosinophils, etc. That can cause an autoimmune cascade and your body making antibodies against tissue based upon that. Complement protein, which are complement proteins we talked about in another video, are like little landmines throughout your body. And if those aren't being regulated, killing pathogens, then you could have that upregulation and growth of pathogens, overgrowth, causing an immune reaction, causing antibody production to self-tissue. The list goes on. I won't go through all of this. There's too many things to go through. We're only going to touch on just the different stages in this video and how this relates to how you would address it as a clinician and how you'd address this as a patient. I want you to see the seriousness of it, but I want you to see the complexity of this too. I know that courses, like our courses, we never want to give anybody the idea that, it's just a simple fix. You're just like one supplement away from a magic cure, or there's just one tool away from causing all your symptoms to go away. I certainly don't want to be a pie-in-the-sky practitioner that's leading you on to something that isn't true, because I think, at least I've been a practitioner for a lot of years, and the number one thing I hear from people, let's say with chronic Lyme or chronic autoimmune disease, is that they don't want to feel misled because they've been misled by different practitioners, which I think is very sad. practitioners that say, well, oh yeah, we can cure you of this disease when you just follow our protocol, and this is the cure for Hashimoto's, or this is the cure for chronic Lyme. It's never that simple. When you have self-antibodies, it's not about curing, it's about managing. And it's about you learning the complexity of it so that it calms your mind and gives you the sense of control back that, hey, okay, maybe I'm never going to be cured of this chronic Lyme and the symptoms that I'm having from it, but I'm going to be able to better self-manage it and keep myself from flares. And when I do get this horrible flare, I know what to do to help calm it down. It's not going to be magic. It's not going to be an easy solution, but it's better to understand what's going on so that you can better manage it, not just from a physiological standpoint, but from a mental standpoint. That you don't think that you're going crazy, because this is what I hear all the time. And that you've been to a million doctors and nobody understands you, nobody can diagnose you, nobody can figure this out. And the reason is because it's very complex, and that's what I want these videos to get to. It is a very complex situation, but there are some manageable tools. So if you could wrap your head around the complexity of it and then understand that, okay, now what do I have to do? Now I understand that this is complex. I'm not looking for a solution that's going to magically erase this, but I'm looking for a solution on how I can calm this down. Getting back to our talk here, there's organ-specific autoimmune diseases. Many of you have been diagnosed with that. Multiple sclerosis is an organ-specific autoimmune disease. Antibodies to myelin sheath cells, and now you got immune destruction of myelin sheath cells. Thyroiditis, Hashimoto's. You have antibodies, TPO antibodies to the thyroid gland, and now you can have immune destruction of the thyroid gland. An organ-specific autoimmune disease is destructive enough, and looking at the triggers that fire that, looking at the cross-reactive things that fire this autoimmune disease, that ramp it up and make it worse, is complex enough. It gets more complicated when we deal with systemic autoimmune diseases. So systemic autoimmune disease like systemic lupus or rheumatoid arthritis is even more complex, because not only do you have antibodies to a particular tissue, but with systemic autoimmune disease you have antibodies to DNA and or collagen. And the problem is, how many organs have collagen? How many organs have DNA? All of them. So all of your tissue has DNA, because every cell has DNA. So then you can get multiple autoimmune diseases, multiple diagnoses, because you're developing antibodies to DNA or collagen. It becomes a much more serious disease. So systemic autoimmune diseases, it's really finding those triggers. We're going to go over treatment and such in another video, but you're looking for triggers, looking to calm down this immune response, looking to upregulate Treg cells. Depending on whether it's Th1 or Th2 dominant, you're looking at balancing that back out. There are some treatment parameters that you have to go through. However, it's all about managing and trying to calm down and trying to get into a state where things have settled down and the disease is much more manageable and you are self-regulating yourself. That's the idea in all of these disorders when we're talking about autoimmune disease. Here's a good test that you could have a practitioner run. This is called an ANA comprehensive panel by LabCorp, but a lot of other Quest labs and other labs may run these panels. But this, you'll notice in this panel, it's looking at anti-DNA antibodies to DNA. It's looking at different, this is Sjogren's antibody test here, anti-chromatin antibodies. This is giving you a nice picture of DNA antibodies. In this particular example is the sample report. None of them are flagged. This person is negative for these. But if a person has positive DNA antibodies, the case just got much more complex, because any cell can be affected, and we're really working on just calming that down. So just another lab test that you can look to rule out some systemic DNA antibodies, which makes a case even more serious. So again, back to our stages. Silent autoimmunity, I have elevated antibodies, but I really don't have any symptoms or loss of tissue. Most of these people aren't going to do a blood test to find this out unless you have maybe other symptoms going on, and you go to a functional medicine doctor that's going to run an antibody profile. It's very beneficial to do if you were exposed to Lyme or you were exposed to mold. But running that Array5 antibody profile from Cyrex, we'll look at some examples of that, can be very beneficial to that person even if they don't have any symptoms. And they will find that sometimes that they have symptoms and they'll have antibodies that relate to those symptoms, but then they have antibodies to other tissue that they have yet to have symptoms in, so they might actually be in stage 1 autoimmune disease with antibodies present in one organ, but maybe a stage 2 or stage 3 with symptoms, and maybe stage 3 with even symptoms and tissue destruction in another organ. And I'll show you in some examples here. So when you're looking at evaluating a person for autoimmune disease, they may have elevated, increased levels of self-tissue antibodies to self-tissue of some organ, and then you evaluate, do they have clinical signs and symptoms? Usually, if they're at a practitioner's office, they came in because they had clinical signs and symptoms, and then you did the test for elevated antibodies. So usually it's reversed in a clinical setting here. They have the signs and symptoms present, and then you're deciding whether they're in stage 2 autoimmune reactivity or stage 3, and you have to do further testing and examination to determine that, and that will guide the treatment phase. Here's a perfect example of somebody that might be in phase 2 or somebody that might be in phase 3. Stage 2 or stage 3 of autoimmune disease. The younger hand there, this has to do with rheumatoid arthritis. The younger hand here is starting to develop clinical findings. They have joint swelling. Obviously, prior to this, they probably had pain for maybe some time. Remember, you can move from stage 1 to stage 3 relatively quick. And then the older looking hands here, obviously in stage 3 rheumatoid arthritis, severe physical deformity of the joints. That's something that is not going to be correctable. It's something that you're going to want to manage and hopefully decrease the inflammation and thereby decrease the person's pain. Remember, most of the pain is caused from inflammation. If you could do things to decrease the inflammation and manage this patient, you're not going to change the clinical findings of the deformity, but you can change the symptom patterns and improve the quality of this person's life. If you could catch this person in, let's say, the younger person's hand, they already are getting swelling, maybe in stage 2 or stage 3 already, because you can see the clinical findings. If you could catch them at an earlier stage, meaning you did a profile, this is an Array5 from Cyrex labs, the labs that we recommend for autoimmune testing. And you can see this Array5 runs through 20-some different multiple autoimmune reactivities. So anything in the yellow or red is positive, and the yellow does not mean that it's in a different stage than a red. So here in this case, look at this example. This is showing positive, equivocal in the yellow for intrinsic factor. Well, intrinsic factor is the process on how you absorb vitamin B12. It's in your stomach, and intrinsic factor, you can develop antibodies to that protein in intrinsic factor, and then you can end up with B12 deficiency because you have an autoimmune reaction to intrinsic factor. In this case, this person does. Let's say they have no symptoms of B12 deficiency. We do a B12 test, that's within normal levels. They have no fatigue, they have no homocysteine issues, which would be common with if they were in stage 2 or stage 3. um, intrinsic factor autoimmunity. So they could very well be in stage 1 intrinsic factor. Maybe you did this test because in this case the patient had chronic inflammatory joint pain, but then you found that they also have antibodies to intrinsic factor. Well, I don't have any symptoms of fatigue. I don't have any symptoms of homocysteine issues. I don't have any other blood tests that show any relativity to having antibodies to intrinsic factor. But remember, a person could move from stage 1 to stage 3 overnight. They should start doing things as if they have full-blown autoimmune disease to intrinsic factor, because that could cause major other symptoms like chronic fatigue and all sorts of issues that could cause other health issues too. If they stop absorbing B12, there's a whole cascade of things that could happen through the methionine pathway that you want to address now that you have this test. Even if the patient came to you with chronic inflammatory joint pain and had no symptoms, signs, or anything that led you to think that they had any intrinsic factor issues. So hopefully that explains that. So, but in this case, this person has antibodies to collagen complex. So, but remember, let's say this patient came to me and they have chronic inflammatory joint pain. That was their main symptom. And let's say I have this horrible joint pain. I think I have Lyme disease. We run array 5 and sure enough, we have antibodies to collagen complex. So what tissues have collagen complex? Well, certainly your joints have collagen complex. This could be the cause of all their joint pain. They have an autoimmune reaction to collagen, and that's affecting their joints. So every time the immune system is sparked and it attacks collagen, this person's symptoms get worse. Now we have to dig in to the rest of the story and see, this is the treatment phase that we'll talk about in another video. What is sparking this immune reaction? Is it food? Is it this person's diet? Is it an environmental thing? Is it heavy metals? Is it exposure to other tick bites? Is it exposure to other viruses or bacteria? Or is it mold? Is it EMFs? Is it this is where it gets really complex. We already know they have antibodies to collagen complex. We know that they're in stage 2 or stage 3 because they have symptoms. So remember again, stage 1 is they have antibodies but no symptoms, no clinical findings. Stage 2 is they have antibodies and they have symptoms but not a lot of clinical findings. Stage 3 is they have antibodies, they have symptoms, and they have a lot of clinical findings. So based upon this person's history, based upon the examination, based upon other knowledge, we know that this person with chronic inflammatory joint pain has collagen complex antibodies. They're making antibodies to collagen every time, and it's definitely affecting their joint because they have joint symptoms. Let's say they have other objective findings on examination. They could be in stage 2 or stage 3 autoimmunity. So we need to now dig into the rest of the story. What's firing this up? We can't erase the fact that they have antibodies to collagen complex, that if any functional practitioners say that they can cure your autoimmune disease, they're saying that they can cure the fact that you have antibodies to collagen complex, and I'm sorry, but they're lying to you. That just doesn't exist. We need to calm that down, and antibodies to self-tissue can dissipate and can decrease, and that's the whole idea. We need to calm the reason why that's flaring up down as much as possible, and that's going to be some trial and error effort in that. Notice also in this example that this person in this example also has antibodies to synapsin. Well, synapsin is an upper motor neuron component of your joint, or of the neuron joints or the neuron complexes called synapses. So if you're making antibody to your neural synapses in your brain, holy cow, you're damaging your neural tissue. So let's pretend this person goes, I don't have any brain issues, I'm not having any memory issues, I'm not having any anger issues, I'm not having any emotional issues, I'm not having any, other symptoms that they're dealing with. Well, actually, if they have chronic inflammatory joint pain, not to get too complicated, they could have inflammation and destruction of the synapses of the parietal lobe of the brain, causing the pain in their joints. So it gets a little complicated, doesn't it? We need to figure this out. Regardless, this person might only be in, let's say, pretend it's possible that they're only in stage 1 as far as the synapsin. If it flips to stage 3, you're talking about major brain issues, and we certainly don't want to do that. We certainly don't want to see that. Just like with the intrinsic factor antibodies, maybe they're only in stage 1, they could flip to stage 3. When you're talking about brain, when you're talking about antibodies to brain, neural tissue, you do not want to be in stage 3. Okay? So we know this person is at least in stage 1. This is an example patient. We know they're at least in stage 1 based upon their symptoms of chronic inflammatory joint pain. That could actually be coming from the synapsin antibodies, even more so than the collagen complex antibodies, because if the synapsin antibodies are inflamed and being destroyed in the parietal lobe of the brain has to do with sensory function of the brain, and that's where you'll actually feel joint pain, is in the parietal lobe of the brain. That could be actually the cause of the person's symptomatic picture. So you can see how it gets complex. We need to calm this down. You can't erase the antibodies. The practitioner's job is not to erase the antibodies, and your autoimmune disease is going to go away. It just does not. That's why I say autoimmune disease is something that you work towards managing. It's not something that you work towards curing. So we need to work on how we're going to manage this and calm this down. Hopefully that can help explain it. So this person, if this was the blood test, array 5, from the person with the younger hands there, that could be the reason exactly. The collagen complex, definitely. So if they have changes in their joint capsule, then we know that that is coming from the collagen complex. If they don't have changes in their joint capsule, but they have severe pain in their hands, it could actually be coming from the synapsin. You could actually have the symptoms coming from both, in either one of the younger person's hands or that older person's hands. Hopefully that's not too complicated. I know it's hard to digest all this information. Sometimes you got to listen to this a couple times. Here's an example of a patient with Hashimoto's. So Hashimoto's, it has to do with your thyroid. You have antibodies to your thyroid. Super, super common condition. And you'll see books out there that say, we're going to cure your Hashimoto's. It's nonsense. Here's an example of a person that you do this array 5 on the person, thinking that you're just going to find what you see, the first positive here, the red out of range, which is the thyroid peroxidase, the TPO antibodies. They have antibodies to their thyroid gland. Well, that makes sense because they're already diagnosed with Hashimoto's. They might have already done a TPO antibody test with a thyroid profile and it was positive. But then, oh my goodness, we have some other things positive here. We have antibodies to the ovary or testes, depending on whether this person is a male or female. We have antibodies to osteocytes. We have antibodies to gangliosides and alpha tubulins and beta tubulins. Those two things are antibodies to the brain. Very serious. The osteocyte antibodies. This is what can cause osteoporosis, this chronic inflammatory response on the periosteum of the bone and the endosteum of the bone, causing just erosion and decay of the bone, causing osteoarthritis. What if this person is 25 years old and they're hoping to have children, and they have antibodies to the ovaries? So antibodies in autoimmune disease to your ovaries can be the cause of infertility. So there's multiple things going on here, and this person only thought they had Hashimoto's. very valuable test to know, even if the person is only in stage 1 on all these other antibodies, but they're obviously doing this test, let's pretend, because they know they have Hashimoto's and they're already on Synthroid, they already know that they're in stage 3 autoimmune response for Hashimoto's. We do this test and you see antibodies to other self-tissue. You need to start taking action to help calm that response to those other antibodies, or this person's going to have a lot worse problems than having to be on Synthroid the rest of their lives. Very valuable test. You can see, understand again, make sure you understand that just because you're in yellow does not mean you're in stage 2, or red, you're in stage 3. That has the level of antibody has really nothing to do what stage you're in. People get that confused. Some people go and they do a thyroid test and they're measuring TPO antibodies and they're all excited because their antibodies went down, or they're really bummed because their TPO antibodies go up. Really, the level of antibodies in a test is somewhat insignificant. It has nothing to do with telling us what stage you're in. So your stage that you're in has to do with tissue destruction or noticeable symptoms. It does not have to do with a level of antibodies. I have to clarify that. Quite often when people talk to me about their TPO antibodies, the most common thing that they measure, because they measure TPO antibodies with a complete thyroid panel, and they go, my symptoms have gotten so much better after doing XYZ, but my TPO antibodies went up, and they think, oh my gosh, I need to take more Synthroid, and my doctor's telling me to take more Synthroid because my TPO antibodies went up. That is totally wrong information. They're not understanding autoimmune function. So make sure you're clarified in your mind regarding that. So the yellow or red, or the level of antibody that you have, does not equate to what stage you're in. The stage has to do with whether there's tissue destruction and or symptoms. So, but when you have antibodies, you have antibodies, and they're not going to go away by just taking a magic pill, or you're just one supplement away or one drug away from making these go away. You have to manage these, know what flares them up, know how to deal with them, and that's going to take some work on your part. Here's another example: a patient with clinical symptoms, clinical patterns of demyelination. So they might have already have a knowledge that they have MS, but then we do a workup on them like this. They have thyroid, TPO antibodies, they have antibodies to intrinsic factor, they have antibodies to myelin protein, which we already thought that because they already were diagnosed with MS, but they have other brain antibodies as well. Phospholipid antibodies. What cells have phospholipid? All your cell membranes. Every single cell membrane has phospholipids in it. What else is important with phospholipids? It's how you make bile. That has to do with phase 2 and 3 of your liver detox pathways. It becomes much more complicated case when you start looking at this and say, well, maybe this is why you got some of these other symptoms. You want to evaluate all these things, whether they're in stage 1, 2, or 3. Regardless of what stage they're in, you need to see what triggers these things, see what are the cross reactants to these things. It gets very complicated for the patient, and it can get very depressing. But I don't want you to be depressed by this. I want you to have this knowledge give you, oh, well, this a reason why, okay, now I'm starting to understand why I have these symptoms, why nobody's been able to figure this out, why I've been kind of misled by false promises. I'm not going to have that happen again. I want to take control of my body. I want to dig into how I'm going to calm this down, and I'm not going to give that control to anybody, another practitioner, anybody. I'm going to do this and learn how to calm down the fire that's going on inside my body, because that's really what's going on. So learning the stages of autoimmunity is important. Learning where you have, what tissues you have antibodies to, if you do, is important. And then we're going to get into some videos on how to then calm that down and use some different tools to help calm it down. Doing other tests. I like Cyrex test, and you'll find out why as I go through Cyrex 10 and why it's really important to measure food antibodies, because we have to eat constantly, and when we are eating things that are firing an immune reaction, it's going to affect everything else that I have antibodies against. I made that very clear in a lot of my videos and in all my courses. Once you have self antibodies and you fire an immune reaction, it can cause problems. Especially if you have an autoimmune disease that you're Th1 dominant. So we'll go through those in detail. So I know there's a lot of information. Stick with me, and we're going to keep uncovering this to give you power and to give you the ability to see a little bit more clearly that this isn't simple, but that's okay that it's not simple, because I'm gonna be able to take care of this and learn how to manage it. All right, I love you guys. I'll be praying for you. Again, I want to give credit to Dr. Tatis Karatsian. If you're a practitioner, make sure you look up his courses. It'll be very valuable for you. Thanks.